Welcome to episode 7B of the Career Cumulus Spotlight Series. Today, Joanne gives us a glimpse into a day in the life of a case manager. Can you walk us through a typical day for a case manager?
Sure. So for a case manager, typical day, especially in the hospital, because hospital case managers and community case managers work totally different.
Okay.
A typical day is I'll come in, I have a certain set of patients that I'm assigned, and I will review those patients. Okay. First, I start off with my discharges because that's my priority, is to make sure we want to decrease our length of stay in the hospital.
Mm-hmm.
So I will look at those patients that are discharged, see what their needs are. I'll look and see when they came in, because we do assessments on every patient that comes into the hospital that we deal with.
Mm-hmm.
We do an assessment. We ask them from something as typical, people don't think about, so you live in a home. Well, is it a 1-story or 2-story? And some people say, well, why do they care? It makes a difference. If you're having knee surgery, it makes a difference whether you have a 1-story, if your bedroom is upstairs or downstairs. Do you have the medical equipment that you need? Do you have the help at home? Are you already seen by home health care? Because then we want to make sure we have continuity of care. So I start off my day looking at those discharges first to see, okay, is that patient ready? And when you say, is that patient ready, I'm talking about not just do I have everything set up, if that patient needs to have a skilled nurse or skilled something to have done at home, whether they need physical therapy at home or do they need outpatient physical therapy, but do they need to go to that acute rehab? Do they need to go to a regular rehab? But is the patient really clinically ready?
So there's a lot of coordination, of moving parts, attention to detail again.
Very, very detail oriented. So, something as simple as, okay, the family needs transportation, can't pick up the patient because maybe the patient is on a wheelchair. Well, okay, I can set up transportation, but guess what? I have to make sure, is there someone home to receive that patient? I can't send the patient over in an ambulance and no one's home. Am I sending you back home to a safe environment? Then I go ahead and I look at those discharges. If they're good, I clear that patient. I tell my nurse everything's good. I communicate with the families and the patients. Then I'll go ahead and look at the patients who are brand new and do my assessment on those patients. And then after that, I will look at those patients that have been here for past an X amount. Each place has a certain amount of days. In my particular facility, we're looking at patients with 5 days or more. Why are they still in the hospital? Is it something that really, the patient's ready and maybe the cardiologist didn't talk to the primary? And I'm that person to say, by the way, cardiologist cleared that patient or nephrology cleared that patient. Are we ready for discharge?
Thank you for joining us today. Stay tuned for our next episode where Joanne shares some of the requirements and trainings needed to become a case manager. Don't forget to like, comment, and share this post, as well as follow us for more career insights.